Welcoming a newborn into the family is a really exciting time for everybody involved. And whether you're a mother expecting or just delivered, whether you're a father that's looking forward to welcoming that new one into the family, or whether you're grandparents looking to help your kids out with a little bit of childcare and support, back pain doesn't need to take this process. And in this video, we're going to give you practical tips to make sure that you don't get back pain during this exciting time of life. So in today's video, we're going to make it really applicable for you. Whether you're a mum, we've got some specific advice for you there, the things your body's going to go through, the changes your body's going to go through, the challenges you're going to face. But also at the end of this video, we've got 5 tips that are going to help you, no matter what your role is, to make sure that back pain doesn't rear its ugly head during this exciting time of life. If you do find these videos helpful, then do please consider supporting the channel by giving us a thumbs up or hitting the subscribe button and sharing this with someone that might find it interesting too. That always helps us. Just remember guys, this is not a parenting class. This is 100% focused on your back and the stresses and strain that your back's going to take over the coming weeks and months. So let's get into it. So the first thing that will be helpful is just visualizing that spine, because your body is going to go through a lot of changes as a mother going through the pregnancy process and then immediately afterwards. And remember, the spine here, it's just a bunch of bones stacked on top of one another. Those ligaments, which we're going to go through now, are what really maintains the alignment of this spine. And for the obvious reasons, your body's going to be secreting chemicals that relax those ligaments. So you have a little bit less support for the spine as we go through the pregnancy process and just after. So all of these bones that are stacked up on one another are going to be a little bit more wobbly than they could be. And this is often what leads to a few little minor aches and pains, a bit of sciatica, a bit of back pain during the latter stages maybe of that pregnancy process. So remember, you've got a little bit less ligament support in the spine here, and it is just a bunch of bones stacked on top of one another. So what do we do about that? Well, we've got our muscles. Our muscles in this stage are so important to providing extra support where the ligaments are a little bit more lax. We need them to be lax, and that's a natural part of a human process. But the muscles can overcompensate a little bit during this period to really help provide our body with more support, just from a ligament point of view. The next point is that we've got a baby developing in here, and that's going to pull on the front of the spine and just pull it into different directions. Sometimes ladies will counterbalance and we lean backwards to offset this weight on the front here, and that puts our spine in different positions. Now, again, coming back to those muscles are there to provide support and strength through this section of the spine to hold us up nice and strong as that baby is growing and developing normally inside your tummy. This is really important at this stage that we do pay a little bit of attention to keeping those muscles as strong as possible during this process, because they're going to allow you to have a better time and again overcompensate for that ligament laxity, that relaxing of the ligaments and the slightly lesser support, particularly around the lower lumbar spine and the sacroiliac joints, where they're going to open out a little bit as you go through the latter stages of pregnancy and childbirth. The final point is, particularly in this lower part around the sacroiliac region and the lower lumbar spine, ligaments here really do provide stability. And as we lose some of that stability in favor of mobility, which is completely normal, we are going to be a little bit more wobbly. As we are increasing our weight dramatically, we're putting on a lot of weight very, very quickly, relatively speaking. So we do need to really just take it easy, but make sure that those muscles are there, strong, they're engaged, we have good control over them to protect ourselves as we go through this process. And also the carrying of the weight doesn't stop immediately after pregnancy, it continues, and arguably it's only going to get more. So if we can be preemptive as much as is possible and really do some of these simple exercises like those we talk about in Back in Shape, we're going to help make our body nice and strong and able to effortlessly continue to carry that extra weight and support a wriggling baby as he's growing through the next couple of months and years. This next one is for everybody, grandparents, fathers, mothers, all of you guys, and that is the posture. Don't think that it's just the mum that's going to adopt that sway back posture, that leaning back. Think of it like this: when you're picking that child up because he's maybe a little bit unhappy or for whatever reason, dad, grandparents, you're going to lean back like so. You're going to do that sway back posture to counterbalance. That's completely normal. We will all do it, and we're all at risk of that. So just keep that in mind, because as we sway backwards like that, we really load these lower lumbar discs, these lower lumbar facet joints. We really put a lot of pressure on this section of the spine, leaning back like so. And we're not really using our muscular support to actually hold things upright. So be very careful of entering that sway back posture. The other thing to watch out for is as we sway back like so, our neck will move forwards. So you might think, why on earth do my shoulders hurt? Why does my neck hurt? Why does it hurt out between those shoulder blades? And that's because we're leaning back and pushing our head forwards too far. So please, whoever you are, whichever role you are in this process, make sure that you are not entering that sway back posture too often. We keep our muscles nice and strong, keep our chest out, and we use all of these muscles together to help hold the baby. And just so you know, if you're interested in more about posture generally, there'll be a card up here or a link down here to a recent video we've shot all about posture, just to help you understand what normal is. So this next part was actually one of the main motivating factors for doing this video. It's something that really, seeing patients, ladies that have been through this, maybe they've had children 10, 15, 20 years ago, but it's often not explained, and that is the process of having a C-section in particular. There are other procedures as well which are problematic, but the C-section in particular, involving we've got our core wall through here, which provides stability and protection for our lumbar spine. To have that disrupted from a C-section, often ladies just are not given the advice and guidance of what's really happened. We've basically torn the muscle in that region and we've lost integral support at a time when you're 100% focused on the bundle of joy that's just been born. You're not focusing on yourself, and that is understandable. What we do need to know is that it has happened. So when we can, as soon as it's possible and practical, get working back on that core to regain some of the control, so to make sure that that area heals nicely. And if we can do a successful rehab after that procedure, then we're going to find that we do a lot better in the long term. I've seen too many ladies over the years that have had children in the past, maybe it was 20 years ago as I mentioned, and they really struggle with the ability to engage their core because they've just lost it. Please, 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 if you're watching this and you're a mum that's just had a child, maybe you've had one a while ago, maybe you're expecting, please don't neglect this vital area, because your body's going to need to support a growing infant and being able to carry that growing infant. And if we've had such a procedure, we need to make sure we get our core strength back. Otherwise, it just leaves that little weakness in our lower back, which can turn into back pain, it can turn into sciatica and those other sorts of issues. So please watch out for that. It's something that ladies just do not get enough guidance on at the time. Just remember, it's a nice corset, a continuous corset the whole way around our spine. And if we disrupt it, we need to restore it effectively afterwards. So this little bundle of joy is going to be growing very, very quickly. And they're going to slowly be moving a little bit more, and maybe not as compliant when you're picking them up and putting them down. And remember, that growth is not happening in you. So make sure that you're doing something to improve the strength and stability of these muscles. Make sure we're doing some sort of rehab, and we're going to get to this later, some proactive tips. But as a grandparent, as a father, as a mother, all of you guys are all going to be slowly having to carry and transport a increasing weight, so to speak. And if our muscles are not doing their fair share, maybe we're not doing some extra rehab to make sure we're nice and strong, we might start to find that that weight becomes a little bit too much. It will eventually, of course, but we should be doing some work to improve our core strength, improve our back muscles, to make sure we can partake in this great part of life without it being detrimental. Getting home, maybe if you're the grandparent going, God, my back's killing me, I can't get up. We don't want any of that. So be proactive, and you can beat the rate at which the baby's going to be growing. So back to mothers, remember, if you are breastfeeding, you're going to still be releasing a little bit of relaxing. And all too often there's this position of holding on the hip. And I get parents and patients coming in saying, oh, my mum had a scoliosis, I have a scoliosis, which is the S shape in the spine, because we're constantly doing this and we always tend to do the same side. We want to have, maybe we've got the baby on the hip here and we're using our other hand free. Normally it'll maybe be the other way around, so you've got your dominant hand free. And that position is going to set in quite nicely. And it's something that we all fall foul of, moving over to try and counterbalance again off to the side in this time, as opposed to earlier where we were leaning backwards. Please, please, please watch out for this position, because it does start to set in that misalignment. And then when we stop the breastfeeding process and really the relaxing removes from our system, everything stiffens back up, but maybe we carry on with this carrying posture, which is really going to fix us. So take time, really work hard to stay symmetrical. And this is one really for you mums out there, really work to stay symmetrical, because we want our body to come back to a normal position after this process, so that everything is normal, everything is aligned nicely, and we haven't got any resilient or remaining stress points on our spine. So we wanted to finish up this video with a really practical approach for you, every single one of you guys watching this. So we've got 5 things that are going to help you make sure that you avoid back pain over the coming months. And these 5 tips are principles. So they're not specific examples, they're principles that you can apply to everything. So number one is hip flexibility. We should be doing some work to make sure our hips are nice and mobile so we can get up and down off the floor. There's going to be a lot of times when we're going to be going down onto the ground and coming back up again. So good hip flexibility is going to decrease the likelihood our lower back, our lumbar spine is going to have to stress and strain. So what I mean with the spine is that when we're bending down, we should bend from the hips here so our spine stays straight rather than going like that and then the rest of the movement comes from the spine. That's not very good. That's going to lead to back trouble. So we do not want that. So from a flexibility point of view, what are you going to do? Simple stretches like hamstring stretches, hip flexor stretches, and glute stretches will all help. And we've got more guidance on this in the backinshapeprogram.com. There'll be a link up here or a link down there where you can learn more about that. Point number two is going to be core strength and stability. We want to make sure we learn how to do this. This is really important, as I mentioned. If you're the mother that's just been through a C-section or something like that, we want to make sure our core is strong. That core set is a strong functioning unit that can protect our spine as we're going over the next couple of months. And that's for all parties involved. Again, guidance in backinshapeprogram.com on how you can learn to engage that core, and then more importantly, how you can build it too. And just before we get on to number three, remember, it's not sit-ups, it's not crunches, and it's definitely not leg raises. Doing the wrong exercises right now, which you might be tempted to do, can lead to things getting a lot worse very quickly. Point number three is strengthening those back muscles. As if it wasn't already obvious, we've been through it during this video. We want to be doing simple exercises like rows, reverse flies, those sorts of activities, even those hip hinges, which are going to be really important over the coming weeks to strengthen up, shore up those muscles and how they work in an integrated fashion as we go through all sorts of movements on a daily basis. So points 4 and points 5 tie into one another. Number one is do this. Take a knee, go down on the knee. Yes, if we've got some knee issues, then we can always use a cushion. But going down on the knee decreases the stress that's going to go through the lower back. And this ties back in to the other points of hip flexibility, for example, in point number one. We want to get down on the knee, especially if we're playing with a little guy or little girl on the floor, they're playing with their toys. Go down, take the knee, don't bend from the back. That's going to be trouble. And the final one, don't sit there for hours sat on the floor cross-legged or something like that. And I'll show you why. The mechanics of sitting down put a lot of forward bending through the lumbar spine. So you may not think that, but as we sit, or as we're standing, we should be in this position. As we go into the sitting position, we go round like that. And this again is partially because our hips are not as flexible as they should be. And that is going to constantly compress this lumbar spine. Then you're leaning forwards and doing those other sorts of movements, which are going to be a bit problematic for that L4-5 and L5-S1 region. So do try and steer clear of sitting for extended periods. Maybe even arrange a few cushions so you can kneel down instead. That's a much more biomechanically effective position for your lumbar spine, and you're going to find that it's going to be a lot easier on you after you've finished and when you go to get back up, because you haven't been in such a compromised position for that length of time. Do please watch out, because we don't want you sat down there having a lovely time, you go to get up and boom, we're stuck on the ground. Watch out for that one, because it's a big one. So there we have it. Hopefully you found this video full of tons of value, got some pragmatic tips and maybe learned something new. If you know someone else that might find this video helpful, then do please consider sharing it. Subscribe to the channel if you find these videos helpful, and we look forward to seeing you next time with another video. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune into some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.